So just going to talk about respiratory assessment for physio. Basically when we do auscultation to listen for normal breathing, diminished sounds which can be indicative of fluid or air in the lungs, or added sounds. Added sounds can be crackles, and crackles can be heard on inspiration, and they can be caused by secretions, mucus and atelectasis, so closing of the alveoli. When we hear crackles on early inspiration, this is indicative of larger airways, but when we hear crackles on later stages inspiration, this is indicative of the smaller airways. And then another added sound that we can listen for is a wheeze. A wheeze is vibration of narrowed airways, and this is to increase the work of breathing. When we've got an expiratory wheeze with a prolonged expiration phase, this can be indicative of bronchospasm and stuff like asthma. But when we've got a wheeze on inspiration and expiration, a low pitch wheeze should I say, this can be caused by edema, secretions and mucus. Another sound we're going to listen for is pleural rub, and this is where the visceral and parietal pleura actually rub together, and it's suggested it sounds like someone walking on snow. So yeah, now I'll get my patient, which is Derek, and we'll just show a few points where we'll auscultate on the front and the back. So on the front here, I've pre-marked, we've got 6 markings. As we were talking through the anatomy before, we've got marking 1, 2 and 3, which is the apical and anterior of the upper lobe. And we've got 3, and then 4 is the medial of the middle lobe, and we've got 5 and 6, which is the lateral and anterior of the basal lobe. So when we're doing auscultation, make sure it's always on, give it a tap. So what we'll do here is we'll get Derek to take a deep breath in when he feels the contact of the stethoscope. So if you can just breathe in for me, Derek. And we're always listening a full breathing cycle, so inspiration, expiration, and then we're going to compare it with the other side. Yep, and then if we'll just look on the back, so Derek, if you just spin round, and just spin round. So again, focusing on that, the right side of the lung, but this time we've got 7 markings, which are pre-marked out there. Marking 1 and 2 is the apical and the posterior of the upper lobe, and then we've got 3 and 4, which is the superior of the lower lobe, and 5 is the posterior of the lower lobe, and 6 and 7 is the lateral and anterior of the lower lobe. And obviously to get a better reading of listening to the chest, we could maybe ask the patient to bring the arms up, so this brings the scapula out. Sweet.